It's Tuesday, November 26th, and this is the Daily Medical News, where we bring you clinical medicine's top headlines, as well as an in-depth look at the day's biggest story. I'm Mary Ellen Schneider.
And I'm Nick Andrews. Today, the oral anti-inflammatory colchicine cut post-MI events.
A new study underscores the link between gout and greater cardiovascular risk.
Cognitive and psychiatric symptoms at the time of a Parkinson's diagnosis predict dementia and death.
And metformin reshapes the risk of later diabetes in women who've had gestational diabetes.
Plus, new osteoarthritis management guidelines jettison traditional treatment algorithms. But first, we'd like to say thanks to all of you who have helped us make this podcast better by taking our short listener survey. If you haven't done that yet, please complete the survey by following a link in the show notes. And now, the top stories in clinical medicine.
A relatively affordable gout drug may deliver what a pricey biologic agent has already demonstrated: protection against cardiovascular events after a heart attack. The Colchicine study included more than 4,700 post-MI patients. Researchers at the Montreal Heart Institute presented the study's findings at the American Heart Association scientific sessions. The oral anti-inflammatory Colchicine significantly cut cardiovascular events by 23% compared with placebo. Colchicine was combined with a post-MI regimen of aspirin, a second antiplatelet drug, a statin, and in many patients, a beta-blocking drug. Colchicine's performance appears to replicate that of relatively expensive canakinumab. In the earlier CANTOS trial, a canakinumab injection every 3 months led to a 15% drop in cardiovascular event incidence compared with placebo.
Gout may herald a significantly greater risk of fatal and non-fatal cardiovascular disease events. That's according to a large population-based study in New Zealand. Researchers at the University of Auckland in New Zealand reported the findings at the American College of Rheumatology's annual meeting. Compared with the general population's estimated 5-year risk of cardiovascular death, non-fatal MI or stroke, or other vascular event, people with gout were at 20% greater risk of a fatal event, and they were 32% more likely to have a non-fatal first cardiovascular disease event. Surprisingly, allopurinol treatment didn't seem to dent gout patients' risk. CVD risk was greater in those who hadn't used the drug and in those who'd been given allopurinol at least once in the prior 5 years. Serum urate levels also didn't affect risk. Those with levels below 6 milligrams per deciliter and those with levels of 6 and above showed a similarly elevated risk of fatal and non-fatal events.
Having cognitive or psychiatric symptoms at the time of a Parkinson's diagnosis may portend greater risk of dementia and death. In patients with cognitive or psychiatric symptoms at baseline, dementia and death were about 4 times more likely after 11 years, compared with patients diagnosed with motor symptoms alone. Parkinson's disease often is staged only as mild, moderate, or severe. Sometimes cognitive and psychiatric symptoms are not assessed. Researchers at Washington University, St. Louis went looking for clinically relevant subtypes beyond those mild, moderate, and severe stages. They found that patients fell into 3 patterns: motor symptoms only, motor symptoms plus prominent anxiety or depression, and motor symptoms plus cognitive deficits. Compared with patients showing motor symptoms only, those with cognitive deficits were 4 times more likely to develop dementia, and those with anxiety and depression were 3 times more likely to progress to dementia than the motor symptoms only patients. The researchers' takeaways: the newly identified clinical subtypes could inform patient prognosis, and the findings emphasize the need to assess more than just motor symptoms. The results were presented at the annual meeting of the American Neurological Association. We'll be back after this message with more medical news.
Welcome back to the Daily Medical News. I am Nick Andrews. Metformin plays a key role in preventing or delaying type 2 diabetes in women with a history of gestational diabetes. That means the drug should be front and center for clinicians who hope to stave off the remarkable incidence of type 2 diabetes after gestational diabetes, or GDM. That's the advice of Dr. Robert Ratner, who spoke at the biennial meeting of the Diabetes Pregnancy Study Group of North America. Dr. Ratner says the Diabetes Prevention Program trial, or DPP, established metformin's role after GDM, and recent 15-year follow-up data cement it. The drug stacked up equally to lifestyle interventions among DPP patients who had a history of gestational diabetes. Both metformin therapy and lifestyle interventions cut the incidence of diabetes by about half over 3 years in women with a history of gestational diabetes compared with placebo. And a recent review of 15 years showed metformin still delivered a 41% risk reduction among women with a history of GDM. Dr. Ratner, who is with Georgetown University in Washington, D.C., adds that those lifestyle interventions were intensive. In contrast, metformin is inexpensive, well-tolerated, and has a long safety record.
New guidelines for managing osteoarthritis of the hand, knee, and hip lay out a wide range of treatment options, all without an algorithm or treatment hierarchy. The guidelines also make strong recommendations for non-drug interventions, and they emphasize the need to tailor treatment plans to individual patient-level factors. The recommendations are a joint initiative, no pun intended, by the American College of Rheumatology and the Arthritis Foundation. The ACR last released osteoarthritis guidelines in 2012. Dr. Sharon Kolasinsky is chair of the ACR Guidelines Panel and professor of clinical medicine at the University of Pennsylvania in Philadelphia. She discussed the guidelines at the annual meeting of the American College of Rheumatology. Dr. Kolasinsky says the new guidelines ditch the stepwise algorithm approach, favoring instead an emphasis on comprehensive management. And there's no hierarchy to the recommendations, apart from the strength of the recommendation. She advises clinicians to make treatment decisions based on a patient's disease severity, whether the patient uses medical devices, and on a patient's own risk factors. The new guidelines place a strong emphasis on educational, behavioral, psychosocial, mind-body, and physical approaches. There are strong recommendations for the use of exercise, including aerobic, strengthening, neuromuscular, and aquatic exercise. And weight loss carries a strong recommendation for patients with hip and knee osteoarthritis. Among the therapies given a thumbs down by the guidelines panel, transcutaneous nerve stimulation for hip and knee OA. There's also a conditional recommendation against using modified shoes and pulsed vibration therapy in knee osteoarthritis. For a complete look at the guidelines, click the link in the podcast notes. And that's it for today's Daily Medical News. Remember, you can find the Daily Medical News on Apple Podcasts, Google Podcasts, Spotify, Pandora, Stitcher, and TuneIn. For MD Edge, I'm Mary Ellen Schneider.
And I'm Nick Andrews. Thanks for listening to the Daily Medical News.